say or send my gratitude to Gwen for the introduction. So what a wonderful way to start. I'm going to share my screen. Should we start there?
Yeah.
Can you all see that? Good?
Yes.
All right. So again, thank you for this invitation. And I want to thank everyone who's called in today to join us to discuss wellness, which is a topic that I'm deeply passionate about. So I'm going to delve right in. There's so much that I want to cover. I know we only have about a half an hour to get through these slides, and then I want to open this up so that we can answer questions, and I'm hoping we'll have some interesting dialogue to discuss. I'd like to begin my talks always with, let's see, I'm not sure why, Liz, the slides are not moving. Oh, there we go. I always like to begin my presentations with a personal introduction. I have somewhat of a challenging name, so we'll start there. My name is Saray Stancic, and I have been a physician for 27 years now. By training, I am an internist and an infectious disease specialist, a field I became deeply interested in as a young medical student. You see, I went to medical school in Newark, New Jersey in the late 80s, early 90s, and regrettably, that period was coincident with the height of the HIV epidemic. And as you might imagine, within that experience, I witnessed unspeakable human suffering and loss, and I wanted to be part of that solution. So when I completed my internal medicine training, I went on to a fellowship in infectious diseases. Now, it's important for me to state this. I am very proud of the work that I did in the field of infectious diseases over more than 15 years, not only in patient care, but also in research and helping to develop better treatments for those affected. But today, I no longer practice infectious diseases. Today, I practice this relatively new discipline called lifestyle medicine. Now, lifestyle medicine is not complementary or alternative medicine. It is simply mainstream conventional medicine, but with an emphasis on prevention. Lifestyle medicine features or empowers patients on the importance of optimal nutrition, physical activity, stress management, effective sleep hygiene, the avoidance of tobacco and substance abuse, and the importance of social interconnectedness. Now, why is all of that so important? It's important because we know when we optimize these aspects of lifestyle, we can indeed prevent nearly 80% of chronic disease, which I'm sure you will agree is extraordinarily powerful. But the logical question that most have after I tell them that story is, how in the world does an infectious disease physician with the experience I just described to you evolve into a passionate advocate of lifestyle medicine? And in order for me to effectively answer that question, I need to go back to my personal story, which began on October 11th, 1995. On this day, I was a third-year medical resident working a really busy shift at the hospital. And I was literally running from one end of the hospital to the other. And it wasn't until sometime in the mid-morning hours where I finally found an opportunity to take a nap. I remember making my way there to the on-call room, and the minute my head hit that pillow, lights out. Shortly thereafter, I was paged again to address another urgent patient matter, but when I tried to get up out of that sleeping position, an extraordinary thing happened. I couldn't feel my legs. And so just like that, abruptly and acutely, I found myself in the emergency room undergoing an MRI of my brain and spinal cord. And those studies confirmed a diagnosis of multiple sclerosis with multiple lesions in both my brain and spinal cord. I was immediately admitted to the hospital and started on IV steroids to treat that acute event. At the time, my doctors explained to me that I had significant burden of disease in both my brain and spinal cord, and I was likely to be in a wheelchair within 10 to 20 years. And the best they could do was to immediately start a new drug that had just been approved by the FDA called the disease modifying therapy that could potentially slow that progression. So I found myself starting this medication with its significant side effect profile, a drug that I had to inject every day, which led to more and more prescriptions. Bottom line, by the time I would say 2 to 3 years into this diagnosis, I was taking about a dozen medications. And despite all of these medications, my disease progressed. 8 years into the diagnosis, I was largely dependent on a cane or set of crutches. And to be frank, at this point, I began to lose hope. And then I guess the darkest moment came the brightest light. By chance, and I call this my aha moment, I came across a publication that discussed a connection between diet and multiple sclerosis. And I was struck by this because here I was, this dual board certified attending physician. I knew little to nothing about diet and nutrition and what role it played in the disease state. But it was this study that really sort of piqued my interest and catalyzed this desire to learn as much as I could about how diet influenced disease. And so I turned to the scientific literature looking for answers. And this was one of the first studies that I came across, published in the New England Journal of Medicine in 1952 by this gentleman, Dr. Roy Swank. And now Swank was a physician, was very interested in multiple sclerosis. And he noted as he studied this disease that he found that in the areas of the world where they were consuming the most amounts of saturated fat, this is where they had the highest rates of MS. So Swank in the 1950s hypothesized that somehow saturated fat consumption was playing a role in the pathogenesis of multiple sclerosis. Now, interestingly, he didn't just leave it at hypothesis. He actually started treating MS patients in the 1950s with a low-fat plant-based diet, and in fact followed 140 patients over 20 years and published his findings in the Annals of Neurology, but didn't stop there, followed them an additional 14 years, and ultimately published his findings in the journal The Lancet in 1990. And so what did he find after following all of these patients for 34 years? Those who adhered to the diet showed significantly less disability and lower mortality rates. And of those that survived, 95% remained physically active. Now that truly resonated with me because every time I saw my doctor, he reminded me that I'd likely be in that wheelchair within 10 years. So this data, again, just further catalyzed this interest in learning more and more. As I delved deeper into the literature, I found more and more evidence that certainly diet could be playing a key and important role in this disease. And it wasn't just diet. There were other aspects like sedentary behavior and alcohol and smoking and excess weight. And I began to sort of understand that these lifestyle factors were playing a significant role, not only in my personal disease, but also in the many chronic diseases that I was seeing as a practicing physician. At some point, I had learned enough that I was convinced that I needed to implement changes in my own life. And one of the most important factors that I came across was understanding the study of epigenetics. And this image so nicely captures what epigenetics is. Epigenetics was first described in the 1950s, but really sort of flourished in the 1980s. And essentially, what epigenetics tells us is that just because we have a gene that predisposes us to a disease doesn't necessarily mean that it will be expressed. So imagine, if you will, identical twins. And this slide, on one side, we have one twin that lives a very active lifestyle. You can see he's consuming primarily whole plant-based foods. You see the windows open, he's getting sunlight and fresh air. Very different lifestyle than the twin on the other side, right? Couch potato, the curtains are drawn. He's consuming a lot of processed foods. And we can see that physically he looks very different. And we could imagine what he might look like on the inside, what the intima of his coronary arteries might look like. And this idea of epigenetics is so powerful because it puts the control back in the patient's hands, right? We know, of course, that genes play a role, but don't let anyone tell you otherwise. Lifestyle matters most. And so at some point, I realized that I needed to implement these changes in my life, and I made the unconventional decision that I was going to responsibly taper off of every one of those medicines that really were not serving me, because despite my compliance with them, my disease was progressing. And as I said, by 8 years, I was dependent on that cane or crutch. The first thing I did, again, empowered by the evidence in the literature, was I changed my diet and I adopted a plant strong or plant predominant diet. And the reason I did that was not because it was a trending at the time or it was popular. It was because the body of evidence in the literature spoke to a diet rich in fruits, vegetables, whole grains, legumes, nuts, and seeds as being the ideal diet, not for MS, not for diabetes, not for heart disease, but for all of us, that it could serve and reduce risk of chronic disease and improve quality of life. The next thing I did was I began to exercise. Believe it or not, back in the 1990s, exercise was thought to worsen MS outcomes. So my physicians actually advised me to not exercise. So I was very deconditioned after doing little to nothing over 8 years. And so the best I could do, assisted by my husband, is to get onto a stationary bike, and I could do a minute or two, and then exhausted and in pain, he would support me to get off, and it would take 10 to 15 minutes to recover. But every day I got back onto that bike, and over time I built strength and endurance. Stress. I brought my team together at the VA, and I let them know that I wasn't going to take on that extra clinic time or that new research project. For the first time in my life, I was going to put myself first. So everyone knew at 5 o'clock, Dr. Stancic was leaving. Of course, if there was a patient emergency, that would be different. But on average, I was going to leave at 5 o'clock every day. And so that was understood. Sleep. Sleep was one of the most difficult tasks that I had before me because I was addicted to Ambien or hypnotics or benzodiazepines like Ativan because my doctors freely prescribed them to me as an MS patient. So I had to learn how to taper off of these medications and really understand sleep physiology, create a healthful environment in my home, in my bedroom, understand pre-sleep rituals. And so I learned how to sleep. And I have to say that what was one of the most powerful recognitions for me was learning how to sleep effectively. And it really changed the course of my life in a very meaningful way. And you know what happened as I implemented these changes? It didn't happen in a week and it didn't happen in a month, but over time, I started to feel better. First, it was something as subtle as I could stay up past Jeopardy. Or on a particular day, I got to work, and for the first time, I felt confident enough to leave the cane in the car. Over the years, I continued to improve. In 2005, about 2 years into the diagnosis, my brother, who was visiting me from Los Angeles, had recently run the Los Angeles Marathon, and he saw how I had been on this journey of improvement, and he raised the question to me, I think you should run a marathon. And I remember shooting him a look almost angrily saying to him, I can't run a marathon. I have MS. And I often say to him, it was one of the greatest gifts he ever gave me because in that moment, I think I awakened in recognizing that I had been living my life as this woman first and foremost with MS. And with that label came so many limitations, things I could do and things I couldn't. So I realized that I needed to restructure my approach. And so without telling him, I went out and started to do a little bit of running or jogging, and it didn't go so well. I'd fall and scrape my knees, but I would heal up and try again. And I'm happy to say, long story short, that on May 2nd, 2010, I did cross the finish line at the New Jersey Marathon. And it was an extraordinary moment for me, not because I ran a marathon, but because all of these changes that I had implemented in my life had certainly borne fruit. And today, 25 years since that diagnosis, I am disability free and medication free. And largely, this is why I'm so passionate about my work and why I think it's so important to share this all important message with whomever is willing to hear it. So I'm grateful to all of you for allowing me to express that. I do want to add that this year was actually 25 years since my diagnosis. And on the day, October 11th, 2020, I commemorated or celebrated 25 years since that diagnosis by walking 25 miles with family and friends. And so that was a very special moment for me. Now, of course, switching the gears now from my patient hat to my physician hat, as a physician, and as I mentioned earlier, by training, I am an infectious disease physician, and that's where I started. But in that capacity, in that experience, of course, I have seen so much chronic disease over the years that I now know is largely preventable. This is the CDC's top 10 leading causes of death. It's no surprise to learn that heart disease and cancer are number 1 and 2. In fact, these two alone account for about 50% of all deaths. We see other chronic diseases here like Alzheimer's disease and diabetes that are exploding in our country. In fact, diabetes, when I was a medical student, rates of diabetes about 2% in the United States. Today, we're brushing past 10%, and the CDC ominously predicts that by 2050, by the time my son is my age, more than 30% of Americans will be diabetic. Something we're doing in clinical medicine today isn't working. Developing yet another drug to treat diabetes is not the answer to the chronic disease epidemic. I want to just show you for a moment what diabetes looks like when you're an infectious disease specialist. This is a common consult that I would see at the hospital. This is an infected diabetic foot ulcer in a poorly controlled diabetic. And the question to me would be, Dr. Stancic, what antibiotic should this patient be placed on? And I would place them on the appropriate antibiotic and debride these effectively. But, you know, diabetics aren't very good at infections and their vasculature is compromised. So often, even though we do all the right things, they end up like this. So now you have a poorly controlled diabetic, status post amputation. This individual is not going to be signing up for a 5K, right? They're going to be more sedentary, their blood sugars further out of control, blood pressure further out of control, and the next event is the heart attack or stroke. And this scenario that I just described to you is not unique to me. It happens every day in every hospital across the country, and no one bats an eye. It's been in large part normalized. But to me, this is unacceptable because I know that diabetes is largely preventable. We know how to prevent diabetes, and yet this is a disease that continues to grow near exponentially. I just want to show you an example of the evidence that we have to support the statement that I just made. This is called the Potsdam study. It was a study published in the Archives of Internal Medicine. Very large study done in Potsdam, Germany, about 23,000 patients enrolled in this study. And the investigators wanted to learn the following. What happens when you engage in these 4 healthy lifestyle behaviors? When you eat a healthy diet, one that is rich in fruits, vegetables, and whole grains with minimal animal sources and removing processed foods, not smoking. Of course, smoking is one of the worst things you could do. Exercise 3.5 hours a week. It doesn't take much, about 30 minutes a day of walking and maintaining a healthy weight. Those who engage in these 4 healthy behaviors, what benefits did they reap? An overall 80% reduction in chronic disease. But if you look at the specifics under that umbrella of an 80% reduction, 93% of diabetes was prevented. This is the disease I just told you is growing near exponentially in our country. 81% of heart attacks prevented. Heart attacks are the #1 cause of death in our country. 600,000 Americans die every year. We have the knowledge and understanding to save 480,000 of those lives. Strokes cut in half, and more than 1/3 of malignancies can be prevented by modifying our behaviors. 1 in 2 of us is living with at least one chronic disease, which is striking. We spend $3.6 trillion per year in our country in healthcare, and 86% of those dollars are allotted to the management of chronic diseases, 80% of which we know today how to prevent. Obesity rates are climbing in our country. I think this is really sobering. You know, I just recently wrote a book that was just released. I started writing the book in 2019. So when I first started, and I was writing the obesity section in the book, I went to the CDC to get the rate of obesity at the time. So in 2019, the obesity rate was 39.8%. As we were running through the last edits of the book in the fall of 2020, I went back to the CDC to check my facts. And at that time, in less than a year, the rate had increased to 42.4%. So in 1 year, obesity rates climbed by 2.6%. Just when we think we're going to plateau, each year it gets worse. If you combine overweight and obese, 70% of Americans fall into one of those categories. That is, in our country, if you're normal weight, you are in a minority. In 1993, and we've known for some time what is fueling all of this. In 1993, Michael McGinnis looked at the actual causes of death in the United States. He wanted to look at the root cause. What was fueling this heart disease and obesity and diabetes? And again, Dr. McGinnis just revisited that question in 2013. And what he found, and what is true today, is that diet is the most important factor contributing to premature death. The standard American diet is fueling all of this chronic disease. This is indisputable, undeniable, and the evidence is profound supporting that point. Now, what I think is striking is that the federal government has known this for some time. In fact, in 1985, there was an acknowledgement that the American waist circumference was growing, that chronic diseases were growing in the wrong direction. And the National Academies of Science actually looked at this because they wanted to assure that nutrition was something that was being covered effectively in US medical schools, because they realized that these connections were important. And so they surveyed medical schools across the country to understand, was this being covered effectively in their curricula? And at the time, in 1985, they found that it was not. Nutrition education programs in US medical schools are largely inadequate to meet the present and future demands of the medical profession. So in 1985, this report was produced and presented to US Congress. They urged that we needed to create change in US medical schools to assure that nutrition was an effective and important component of medical education. And yet today, here we are 35 years later, and doctors know little to nothing about what is causing the chronic disease epidemic. We know little to nothing about nutrition, and it is incredibly regrettable. We are flatlining here. We are missing an all-important opportunity to really make a significant difference in our patients' lives. Those of you who are physicians or healthcare professionals recognize this flat line as trouble, right? This is what we call cardiopulmonary arrest, and in the setting of a healthcare professional setting, we would of course call for help here, right? And that in medicine is what we call a code blue. At the time, we ask a team of experts, doctors and nurses, to come to the bedside to resuscitate the patient. I introduced this because this is why we named our film Code Blue, our documentary film. We started working on this film in 2015. The film was finally released about a year ago. And the term Code Blue is really about illustrating the urgency, the need that we have to address the healthcare system as it stands today, which is missing this all-important mark. Developing yet more pharmaceuticals and surgical interventions to address our chronic disease epidemic is not the solution to the problem. And you see our tagline here: what your doctor doesn't know will shock you. Literally, it will. And so of course, the dream of the documentarian is always to shed light on the lapse in society. And so we hope that by shedding this with communities across the country and beyond, that we will create a movement for change within our healthcare system to truly reflect the needs of the community. The antiquated medical education model that I'm speaking of is regrettably focused solely and primarily on what we call pathogenesis. So when we go to medical school, and I tell my medical students this, we become really good disease detectives, right? Which is, of course, very, very important. We need to be good disease detectives. So we focus all of our attention on this idea of collecting clues to make that diagnosis, right? So we'll do a thorough history and physical exam. We will collect studies like blood work and imaging studies, all in an effort to ultimately make that diagnosis. And once we have a diagnosis, our treatment plan includes a pharmaceutical agent, a surgical intervention, or a procedure. And of course, all of that is important and should be part of the medical school experience. But the problem is that we miss half of the human health continuum. We don't learn anything about the opposite of pathogenesis, or the mirror image of pathogenesis, which is what we call salutogenesis, the process through which health and well-being are produced. And we learn little to nothing about that. And that is a missed opportunity because it is incredibly important for healthcare professionals to understand the importance of these aspects. So salutogenesis in our medical education would mean modules on nutrition and exercise, mindfulness, self-care. Self-care, I think, is so important. As physicians, we're not very good at taking care of ourselves. In fact, and regrettably, physicians have one of the highest rates of suicide of any profession, depression, and substance abuse. And this is largely because we're not taking the time to take care of ourselves. And I think it's important, I say this to my students all the time, you have to be your first patient. So it's very important on day one that they know how to take care of themselves. They should find time to eat properly and exercise and sleep effectively. Even the way we train physicians is sort of archaic, right? We ask them to work 24, 36 hours. No one should be doing that. So we need to create change on many levels. Why is now the right time? Well, we've known that we've needed to create change rather for some time. Even the National Academies told us in 1995 to bring change to the medical school curriculum. I think right now we are living and universally, not just here in our country, but we're living in this universal, very painful global pandemic. And of course, the pandemic arrived here in the United States in January of last year when the first case was diagnosed in Washington State in a businessman returning from Wuhan. And of course, and you don't need me to tell the story, but it's been a very difficult and painful year. We've lost so many. And hopefully with the development of vaccines, we're on the other side of this, but we still have much to get through. But I think one of the important learnings, I think, and I hope that it is a silver lining of all of this, is that acknowledging and understanding how the coronavirus pandemic, this acute infectious contagion, have intersected with this chronic disease epidemic. And I think we saw evidence of that early in June when the CDC put out data regarding how important the underlying chronic diseases, what role they were playing in outcomes in COVID. And what we learned was that if you had a chronic disease at the time that you were infected with the SARS-CoV virus, that you were 6 times more likely to be hospitalized and 12 times more likely to die. And that was really an incredibly important bit of information to convey to the American public, helping them to understand how we need to address this underlying chronic disease epidemic, maybe now more than ever. And so I pray that the silver lining again of this pandemic is that it is a call to action, and it catalyzes an interest in creating change in our personal lives, in our community, and in our country. It is my hope that we are at a point in history that it is time for us to usher in this era of salutogenesis in healthcare, that salutogenesis and the maintenance of health and well-being should be the foundation of the healthcare, and that we can create this shift in paradigm and in our culture. I want to sort of wrap things up by just again sort of reiterating the importance of nutrition and lifestyle in the field of medicine, not only in with physicians but nursing, any healthcare professional, and so that we can all work together and speak to this ubiquitously and unanimously, so that we can convey these messages effectively to our communities. In that way, I believe we can really truly shift the paradigm and shift our culture so that we recognize the importance of our dietary choices and of our behavioral choices in regards to our personal outcomes. It is no mistake that I named the book What's Missing from Medicine, because clearly I feel that these pieces are missing. I often think of my experience in medical school as this big, jigsaw puzzle, and I received so many important pieces, but it was an incomplete image, because at the end of the day, there were so many pieces that I had to learn along the way later in life, and I think that's regrettable. And it is my hope that moving forward, We do create curricula that offer a comprehensive overview of the entire human health continuum so that our graduating and our future generation physicians are best equipped to manage this chronic disease epidemic and hopefully turn this Titanic around and prevent disease. And so that, and I say this, and I'd like to sort of end with this. It is my hope, based on all that we've learned in the past several decades. And again, with the background acknowledging this, that for so much of my career, I've seen so much chronic disease in the nursing home setting and have seen so many patients suffer at the end of life. It is my hope that we can all empower ourselves to age gracefully, to live to our greatest potential. And on that last day on planet Earth, that we can enjoy a beautiful day with our family and friends, clear of mind, free of chronic disease. And then on that beautiful, joyful day, go to bed and pass peacefully. That is my hope for all of us. And I hope that my work with the book and the film and my ability to share with community that I can serve that in some way. I wanted to just briefly speak to the fact that in the book, I do use this analogy of a wheel in regards to lifestyle medicine. And the reason I use the wheel is because I like how the spokes represent each aspect of lifestyle. And the point that I'm trying to make here is that they're dependent on one another. Some of us are really good at eating healthfully, or some of us are really good at exercise, but then we ignore the other aspects. Maybe we drink too much, or we worry too much about work. I think it's important for us to understand that in order for us to reach what I call the sweet spot, to live our best self free of chronic disease, we really need to pay attention to all aspects of lifestyle. And then finally, I just want to end with a quote that I love by Maya Angelou: "Do the best you can until you know better. Then when you know better, do better." Ladies and gentlemen, today we know better.
Yes.
Thank you.
Oh, thank you. Amen. I have to add that on an amen with that terrific final quotation. Thank you so very much for I'm just going to add our spotlights here, and so inspiring, so much to think about. And we're going to just jump right into some questions. The first one is, does the pharmaceutical industry support research at medical schools? Do you know why there is so little about nutrition and wellness being taught to medical students?
Yeah, that's a great question. And one that I've tried to answer, and we tried to answer in the film Code Blue. I think sadly, the bottom line, I hate to say this, is money. It's not very profitable, right? The whole idea of lifestyle medicine and nutrition, regrettably, is not powerful. If you think about what are the big money makers in a hospital setting, it's procedures like open heart surgery and surgical interventions. Now, with that said, I don't know of any physician that's out in the world saying, you know, I'm so glad I'm making I'm doing another procedure today. No physician goes into medicine because they want to make $1 million. Most people go into physician because they want to do promote health and well-being for their community. But it is an upside down system. What we reward the healthcare insurance companies, they reward these procedures, and they don't reward these preventive lifestyle medicine aspects. So I think that there's a lot of work to be done. I think we need to bring together leaders, both at the level of the federal government, CEOs of hospitals, chief medical officers of organizations across the country. We all need to come together to the same table and discuss the problems that we have today, and how best do we bring our skill sets together to assure that moving forward we correct these missing aspects in healthcare, so that we value the preventive wing of medicine. We currently don't do that.
Okay, there is a question here about the advent of population health reimbursement at hospitals. I don't know if I understand that, but do you believe that that would help move the needle toward prevention?
Absolutely. I think if it's really, again, the driving factor is often money. If we invest in population health, then that's where we're going to gain benefit. But regrettably, right now, I can tell you, for example, that lifestyle medicine or preventive medicine is not very profitable. There are many physicians across the country that are eager to switch their practice and focus on lifestyle medicine or this type of approach, but it's just not profitable. Insurance companies aren't reimbursing effectively, so that it pulls many physicians who want to do it against it because it just doesn't reimburse
Hmm,
effectively.
okay. This is a great question. There are many more people who are getting on board with a plant-based diet, as we know. And so the question is, have you seen any changes in your practice now that, in your lifestyle medicine practice, now that plant-based eating has become probably much more widely accepted or at least understood?
Yeah, well, absolutely. I think plant-based nutrition is becoming more and more well accepted across the board, across the country. And by the way, you don't have to be 100% plant-based, like 100% vegan, right? The idea is to move toward more and more plants. The way we think in our country is the animal is the center of the plate, right? So typically, if you ask somebody, what did you get? What did you order on the menu? They'll say, oh, I had the chicken, I had the fish, I had the steak. Nobody says I had the sweet potato, the broccoli. Nobody talks like that, right? So we need to move our culture and our thinking to thinking that the plant is actually the center of the plate, not the side dish, right? So more plants, less animals, and removing the processing. Um, and the wonderful thing about plant-based nutrition is that, because many patients might come to see me because they want to lose weight or and when you switch to a plant-based diet, it's not about counting calories or weighing food, or because plants in large part are nutritionally dense, what we call nutrient dense, but calorically deficient, right? So if you think about 100 calories of broccoli, that's an near entire bag of broccoli. But if I said 100 calories of chicken, it's just a couple of bites. So animal sources tend to be calorically dense. So you have to eat a lot of it in order to feel full, right? So the key is fiber. Everyone's always worried about, am I getting enough protein? But of course, it's not about protein. We're all getting, I promise you, enough protein. What we're not getting is enough fiber. And fiber is the key, right? So that's the question you should ask yourself every day. Am I eating enough fiber? If you are, then you're going to incredibly reduce your risk of chronic disease, because fiber offers us so many benefits. It protects our heart. It creates a very positive environment in our what we call gut microbiome. We have these bacteria that live in our gut, and we can either have good bacteria or bad bacteria. And when we have good bacteria, these good bacteria produce positive chemicals that then result in good clinical outcomes. And guess what good bacteria like? They like fiber, right? So it's really simple. It's about eating a fiber-rich diet, lots of colors. When you walk into the produce aisle and you see all those beautiful colors staring back at you, those purples, those reds, those greens, those are phytonutrients, phytochemicals, and they're incredibly important in cellular health. So the brighter and more colorful plate you have, the less likely you'll develop a chronic disease like heart disease, cancer, diabetes, these diseases that are compromising our quality of life and cutting our lives short.
So Dr. Stancic, this sounds like, I mean, this is such a great message tonight. But one of the questions is, it sounds like it's not a quick fix, that it's something that takes time. And people get pretty discouraged very quickly when they don't see those immediate results. How do we change our thoughts about a quick fix? How do we learn to be, as you said, on this journey that you?
It's not a quick fix. We have to be patient and we have to be kind. We tend to want, I want to lose 10 pounds in a month. I want that thinking we need to leave behind, because it's detrimental and it's led to really bad, particularly I call this the Oprah Winfrey generation of women. And I love Oprah, but Oprah has been very public with her weight issues and her struggles. And so we grew up in that environment. And how did we lose weight as young women? First of all, we restricted our food. We counted calories. We did anything we had to do in order to fit into those DoorDash jeans. You remember? Anybody remember those? And it's done a lot of damage, right? So we have a lot of women who have very bad relationships with food. And it's always about restriction, about guilt, about cutting things out. And the wonderful thing about plant-based nutrition is that you eat these big, beautiful, generous plates of food, and you feel satiated and you feel full and content. And so but this whole idea of the quick fix is something that I think has done a lot of damage, and we sort of need to almost, if you will, erase that all those experiences and start anew and look at food differently. The value that comes here, just like anything in life, anything that you've done in life that is substantive takes time, right? Becoming a physician took time. It was great effort and a lot of work. I mean, anything that you do, right? When you start university and getting your degree, you don't get it in a week. It's a lot of work, and there are disappointments and there are wins, but every one of those obstacles we experience sort of strengthen our resolve, right? And I think that when it comes to learning how to optimize your lifestyle and improving your diet, when patients come to see me, and they may, this whole idea of a plant-based diet may be so foreign to them, but that's okay. What are you willing to do today to improve your diet? What could we add? Are you willing to add a piece of fruit once a day? Are you willing to take a 5-minute walk? Are you willing to cut down and be a little bit more mindful about that glass of wine that you're pouring? How many glasses, just being mindful of what we're consuming. So taking small steps in the right direction and celebrating every one of them. And when we have a challenge, when we have a setback, and we will, because we're human, we shouldn't be so tough on ourselves, be forgiving and kind. So it's interesting how so many of us are so giving and kind to everyone around us, but we're hardest on ourselves. And that's so important. We need to stop doing that. We need to be kind to ourselves and love ourselves as well as everyone else around us.
A great segue question from what you just said, to dovetail. Where would you put spirituality and meditation within the complex of lifestyle medicine?
Well, it's one of the spokes, right? It's incredibly important. Mindfulness and prayer. For me, it's prayer. For others, it may be mindfulness and meditation, but slowing things down and really shifting perspective. And I think that for me was a big lesson as well. And it was through my faith. Certainly, I can tell you, Liz, when I was diagnosed in 1995, I had just turned 28 years old. I had really worked hard to achieve my dream. I'm an immigrant to this country. I grew up in Newark, so really worked. I mean, I worked really hard to do this, and I finally had achieved my dream, and then the floor fell out from under me, and I was angry, and I felt like on that day that it was the beginning of the end, that my life was over. And it was it would be the worst day of my life. Now, in retrospect, when I look back at that day, it was in fact one of the best days of my life, because it put me on the path to where I am today. All of those difficult moments in my life, the suffering that I experienced through my diagnosis, and the learnings that I gained through that suffering allowed me to be, I think, a better doctor, a better mother, a better wife. And it has just opened up my world in a way that I could have never predicted at the time. So I think my perspective has been this, that regardless of the difficult moments that come in my life, acknowledge that there's purpose behind them, that there's a reason why on this day, I need to experience this difficult moment. And instead of resisting and pushing back those difficult moments, accepting them as they are and having the faith that there's a reason why they're presented before me.
That's terrific. Thank you so much. Pat, I've seen a couple of good questions. One of them, I'm just going to jump on you, Pat, here, because I saw this one that I think a lot of people are wondering how you feel about supplements, because that's a huge growing industry. Should we be taking the nutrition or eating the nutrition? What do you think?
Yeah. So supplements, and it's not how I feel, because none of this is about how I feel. It's about the objective evidence, right? So that's really important to me. Everything that I speak to is not my subjective opinion. I speak to the objective evidence. And if you look at the objective evidence, and there was an interesting editorial that was published in GEM a couple of years ago entitled "Enough is Enough" in regards to the supplement industry. This is a multi-billion-dollar supplement industry that is really doing nothing, and it actually can do damage. And I write about this in my book, using, again, myself as an example. I mean, there are certain supplements that we do need. And like, for example, we might need vitamin D. We live in the Northeast. We don't get enough sunlight. So that might be something that, and I think it's important that you discuss it with your physician to make sure if you do need it, that you're taking the right dose and you're not taking too much. Vitamin D is a fat soluble vitamin, so you can actually accumulate too much. For those of us who are strictly vegan, we may need a B12 supplement. That's a possibility. But in large part, supplements, the way they're described in much of mainstream media, it is unnecessary. There are no clinical or medical reasonings behind having to take all of these supplements, and they're not the magic pill, and they're not going to solve the problems. Nobody wants to believe that the solution to the complex chronic disease epidemic could be this simple, but it is. It's this simple. It's eat a primarily plant-based diet, move every day, manage your stress, get 8 hours of sleep every night, avoid substances like tobacco and too much alcohol. I mean, alcohol in our society, alcohol is a big part of what we do. We celebrate with alcohol, we go to a game, we drink alcohol, but there's no safe amount of alcohol. I know people don't like when I say that. If you're going to have a glass of wine, have one, don't have 2 or 3. But you have to be mindful when you're drinking. It's at the end of the day, alcohol is a carcinogen, and there's no safe amount of alcohol. So if you're going to engage, do it on occasion. Of course, you want to celebrate, have a glass, that's fine. But if you're doing it every night, then it's an issue that you need to be cognizant of. And then the last spoke on that lifestyle medicine wheel is the importance of connectedness, like what we're doing tonight. This is medicine, right? We're sharing our ideas and our thoughts. We're smiling. And regrettably, I wish we could be in person, because this could be so much more fun if we were in the same room and we could do this talk and then have a dialogue. That's, social connections are really, really important. Social scientists Christakis and Fowler have done a lot of research in this area. We know that those of us who have the most connections live longer, right? So it's important for us to have, but it's not just how many connections you have, it's also the quality of the connections that you have, right? So if your best friend is a couch potato who just likes to sit on the couch and eat cookies, then you're probably going to do the same thing. You want to have the type of friend who says, hey, let's go hiking, let's go prepare a really healthy plant-based meal and share it. Those are the types of friends. And if you do have a friend who's a couch potato eating cookies and drinking beer, maybe you can introduce the idea of, let's try something new, let's go for a walk. But we want to move in a direction where we're engaged in these optimal behaviors, because if we do this all as a community, we can certainly shift this chronic disease epidemic and allow for each one of us to live a happy and healthy existence.
So I think too, Dr. Stancic, somebody else was asking, sugar and processed foods, as we're talking about this, are so addictive. Do you have any great suggestions for how somebody could work with these addictions? Where's a good place to begin?
Yeah. Well, I think the most important thing is education and understanding, right? So there's a wonderful book I highly recommend called The End of Overeating by David Kessler. It was a book I read several years ago, and it really sort of opened my eyes to understanding how the food industry creates these foods that really are addictive. I mean, they have these food scientists, it's their job to create foods that will keep you coming back. So they understand the gut brain chemistry, and they create these foods that Dr. Kessler refers to as hyper palatable foods. So they layer sugar, salt, and fat, and the perfect combination to keep you addicted, right? So those Tostitos or those Oreo cookies that you just can't eat one, it's not you. Because a patient will say to me, Dr. Stancic, I have this sweet tooth, I can't stop eating. No, it's not you, it's everybody. Anybody who's put in that position will fall into that same trap. So these food scientists and these food companies, they understand that, and so they keep us under control. So what you need to do is remove all of that from your home and don't engage in it, right? Don't give them the opportunity to control you. And yes, at first it might be difficult to do that, but once you remove these, I call them food stuffs because it's not real food, it's fake garbage, and it is fueling a lot of these chronic diseases. So I remove them from the home, and I think the average person, when you learn that these food companies have these food scientists that are purposefully creating a food that is addictive, doesn't that make you angry? Doesn't that make you not want to buy? I mean, we can do a lot of good with our purse, the power of the purse. If you don't buy it, then guess what? They're going to stop making it. And that will bode best for generations to come, because we want our kids and our grandkids to live happier and healthier lives. And we need to put these companies out of business. We need to support organizations and food organizations and restaurants that are serving foods that are both healthful and delicious.
Amazing. So much to think about. And do you think, though, that the more you eat foods that are sort of more whole and healthy, your body will naturally begin to, because we need sugar, right? So, but it's just, you're talking about a particular kind of sugar. So your body processes the fruit sugars or the other sugars better when you don't have the other things in your system?
Well, ultimately, all food is sort of decomposed into sugar, glucose.
Right.
So what I'm talking about, for example, is an apple versus a cupcake, right?
Okay.
So an apple is sweet, right? But and it has sugar in it. But the reason that doesn't lead to a blood sugar spike is because in the apple, this whole food is, what are we delivering? Fiber, right? So fiber tempers that response. Whereas the cupcake or the cookie is just pure sugar, devoid of fiber, and that's going to cause your blood sugar to spike, and then insulin is produced by the pancreas, and that puts you on that path towards prediabetes, diabetes, and excess weight.
Gotcha. Okay, so there's a lot of questions I have to do with that. So I was trying to field them, trying to combine them all together. I think we got a good answer. And somebody was suggesting that she switched to Ezekiel bread, and it really helped. And one of our dear friends wanted to know if you also put caffeine in that category as maybe not being good either.
Well, no, caffeine is fine as long as you don't overdo it. And so I always say, don't drink caffeine past noon because it'll affect your sleep cycle. I have 1 cup of coffee in the morning, black. I don't add anything to it, and I love it. Don't ever consider taking it away from me.
Okay, good. Many people are blessing you for that wonderful answer. It was the answer we wanted.
Coffee at 2 o'clock. Sometimes I see folks picking up their kids at the school at after school with a cup of Starbucks.
Yeah, I never got that. I can't do that either. So, oh my goodness. Well, we are just at the 8:30 mark and have just learned so much and so appreciate your willingness to be with us. Friends, you have been given on many occasions in emails Dr. Stancic's website and the connections to Code Blue and also her book. And we wholeheartedly recommend that you continue to follow up with her in that way. And it is our message to all of you that as you go out into your week, you be well. Thank you for being with us this evening.
Thank you. Thank you so much. Thank you, Pat. Thank you, Liz.
Thanks so much.
Bye.